Actualmente no existe ninguna relación entre la academia y el gobierno. Hace 2 años había una relación personal con la ministra de Salud, donde se pudieron elaborar ciertos planes para ser proyectados en los próximos 2 años. Cambió la ministra y todo se quedó en nada. No hay relación actualmente.
Yes. I think the Caribbean Academy of Sciences, because of the way it is structured, covering interests from Cuba all the way down to South America, is unable to influence governments on specific health issues in the way that you're raising. The way that we normally help governments is that the governments come to us with specific issues. We've worked with them on water issues and such like, because quite often, although there may be answers within their country, there are often political things about it. One side is going to be viewed as being supporting one political. So we are able to give advice to governments that is without political bias, because we have members in territories all across the region. But for health, we've not addressed that particular problem.
Thank you.
If I can add what Dr. Allen said before, they're in the Caribbean Health Research Council, and they have been around for about 50 or 60 years, and they actually came out of the University of West Indies, and sometimes they help the governments in the Caribbean, ministries of health, to develop programs to educate patients and to guide doctors how to treat people in different conditions, including asthma, including hypertension, diabetes. So there, besides the Caribbean Academy of Sciences, there's also the Caribbean Health Research Council, and they help guide governments on how to implement health programs.
This was no more questions.
There should be more basic research done in this area.
Considering that we have a Pan-American health organization that works precisely on the problems of the region, what is the linkage of these groups with the Pan-American Health Organization in advancing the NCD prevention agenda? Because there are initiatives going on in Brazil, in Argentina, in several countries. The Caribbean has the Caribbean TMRU, which in fact is based and also has 2 bases. One is in Trinidad and Tobago, and the other one is in Jamaica. And they're collaborating centers. So I think that there is an infrastructure to do this. Somehow the academies are not linked to this effort. As a member of the Chilean Academy of Medicine, I have linkages, but they're not within the Chilean Academy of Medicine. So I think that we should really hook up with what's going on, because there are people that have responsibility for this and are moving the agenda nationally, regionally, and internationally.
That's a wonderful idea. Perhaps, Joe, would you like to comment on that? That might be a role for the Academy Medical Panel.
Yeah. What I know is
very, very important questions being discussed right now. Yeah.
I think one of the real challenges is exactly reflected in the first answers that you each gave, which is, as individuals, members of academies are quite influential, but many academies haven't really developed a role for the group of individuals to act as an organization, as an institution. And I think that's something that certainly IANIS, IAMP, Al-Anon, these networks are really trying to develop that capacity, beginning to move in that direction. It's very important to have this conversation because global health is so visible now. But when you look at the actors, academies very often are not part of the conversation, and the expertise really should be part of the conversation. So I really appreciate this discussion.
Yeah.
Thank you.
Yeah, practically in our country, I mean, the Ministry of Health concentrate, I mean, all the relationship with the Pan American organization and other organizations.
I'd like perhaps to also raise the question that brought on the talk about the research on natural products, that while there are a lot of drugs available for treatment of hypertension, heart disease and so on, it's not always available to those who are in the low economic group. And therefore, many people turn to traditional medicine for treatment. Would you like to comment on that, Lieutenant? Yes. We have mentioned that there are a lot of drugs available for treatment of hypertension, diabetes. Some of these are risk factors that you can modify to reduce the problem of cardiovascular disease. But for the low socioeconomic people, they cannot always afford this, especially when the treatment is lifelong. And therefore they turn to traditional medicine, and therefore that excellent work by Dr. Lai-Meng. But would you like to comment about this problem?
Well,
because it's
yeah.
quite a big issue.
I mean, at the public hospitals in Argentina or in Buenos Aires, because I work in a public hospital, this is a big problem. I would say that about 50% of the people abandon, I mean, the drug treatment because they cannot buy the drugs, you know. It depends on the population. If you are working in a very, I mean, important clinic or sanitary with wealthy people, I mean, you don't have any problem. But when you work in a hospital, there are some plans that, I mean, they now are trying to provide the drug, I mean, free, and so this has improved. But sometimes people cannot even go to the hospital, I mean, to get the pills, you know, because they are very different conditions. Poor people, I mean, you know, not only with coronary artery disease or atherosclerosis, but in cardiac insufficiency. I mean, you can see, I mean, cardiac failure is one of the main problems because people go and come, I mean, many times a year, I mean, because they don't do correctly the treatment.
Can I raise a question which is related? Because one of the difficulties that certainly within my region researchers face is that of funding. More often than not, you have to try to source funding in the first world, and there's no good reason for an American institution to fund research in Trinidad when there are 6 or 8 people in the US who are capable of doing the same research. Is there a role for the academies collectively to create some kind of funding to support funding within the research within the region?
Okay, there are now a cross of 2 questions. I believe Dr. Stockings wanted to answer a bit of the first question. We go to the second as well.
In Chile, drugs are cheap and free. So no one can say I'm not using a beta blocker, an inhibitor, an aspirin, or a statin because of money. I mean money for the bus or the train, but not for the drug, which is, I say, cheap and free. And it should be available at any care center. The most basic center in the country should have those drugs. I mean, maybe propanolol or atenolol, and maybe and not sophisticated drugs. We have more problems with heart failure because we don't have bisoprolol or carvedilol. We have atenolol, which has not been approved for heart failure, but for coronary artery disease, for secondary prevention, all drugs are say cheap and free.
Yeah, I add something. Because in Buenos Aires itself, I mean the city of Buenos Aires, I mean people can get free the drugs, you know. But in our hospital, 70% of the patients are coming out from the great Buenos Aires, and they don't have over there the chance to go to that, and they cannot get to the hospital many times.
Comment from Looi.
La mitad de la población no puede alcanzar al medicamento porque es caro o porque no tiene cobertura social. Y los que pueden llegar, generalmente por falta de educación, solamente hay un 30% de adherencia real al tratamiento porque abandonan el tratamiento y tienen complicaciones a consecuencia de esto. Como que nos falta mucho todavía por hacer en Bolivia.
Thank you. And can we now come to that last question? We're running a bit short of time, but it's a challenge posed to the academies as to what they can do to leverage research for cardiovascular disease, especially in the low-income countries. Would anyone want to comment? Not the panels, anybody in the audience? Joe?
Thank you. Yeah. In the executive committee of IAMP, we just completed one of the academies the German Academy actually recommended developing a paper, a position paper for IAMP on this issue of research, supporting research capacity building in low-income and middle-income countries. So I think one possibility, perhaps they can't raise the money, but I think it would be logical for academies to be advocates for research and for higher education in their countries. And we're hoping as a network to be able to develop a paper, and I would be very interested in individuals from this meeting that might be interested in participating in that work over the next several months. So I stand ready for volunteers. We're going to put together a writing group or a review group after the writing group. So anyone who's interested, please let me know.
Thank you. Although, according to our schedule, we do not finish until another 10 minutes. We actually started about 15 minutes ahead of time. So we have actually used up all the time for this symposium. Unless there are further questions, I would like to close this now so that we can perhaps have discussion over tea. I'd like to thank the audience for your participation. I think there have been great questions. But most of all, I'd like you to join me in thanking the speakers and the panel for their very excellent lectures and for the breadth and depth of their presentation and the coverage that they have presented to us. Thank you very much.